pelvic floor physical therapy and home devices do help, and they buy you time if you're not ready to move on or can't make a commitment to some of the third line therapies.
So they've taken some sort of medication to help manage, some pharmaceutical medication to help manage overactive bladder, as well as, I would assume, some lifestyle changes that you coach them on based on their diary.
Yep. And then physical therapy, patients need to have options. Like, this is their bladder. However they want to do it is how we want to do it for them. Because, some people are like, I don't want any of these things. I don't really want a medication. What else can I do? And there's some home devices that help to improve the pelvic floor that have been very successful. There's pelvic floor physical therapy that we refer a lot of patients. It's a female to female pelvic floor. They just work on incontinence. And
what would a patient expect to experience if you send them out to a therapist?
Pelvic floor physical therapist. So the physical therapist will do external work and sometimes some internal work. They do biofeedback. They teach you exercises. They, again, look at your dietary things. They also look at your habits on how often or how few you're going to the bathroom, and they pull it all together in conjunction with us. So they send us a letter to let us know what they're working on and where they are. And then, we respond back so that there's a communication in their care to see how they're doing. If they use a home device, there's a number of them out there, but you need one that actually gives you feedback. So we can all do, let's say, push-ups or sit-ups until we're blue in the face. But if we're not doing them correctly, we're never going to get a six-pack or, a strong abdominal muscles. So if they're using a home device, there has to be some way for it to give you a feedback. So, for instance, there's a device out there called Leva. Your provider has to write the script saying that there's a need of it. And it is a device that I actually have it here, that you actually you do it standing. All the sensors are in this part right here. You just put some water on it and you put it in your vagina and you're standing. And what you're buying is this device and the app. And so when you are doing the squeezes, if you're not squeezing correctly, the lever won't turn over. And so therefore you're not doing it correctly. So then Leva actually has a company that will have people there that will work with you to get you to do this. I actually tried this one years ago when it came out. And at the first 2 weeks, I wanted to throw it across the room because I couldn't do it. And I'm like, why can't I do this? But I realized I went to a physical therapist then and I said, why can't I do this home device? And, it's really hard to know where your weaknesses are in your pelvic floor unless you have an evaluation with a pelvic floor physical therapist. So then once I had that evaluation and then I was able to use the device and I got really good at it. I mean, I'm just going to tell you my score was 100, but I'm just saying you don't have to be 100, but you can see the improvement not only in how you're holding and using your pelvic floor. You can now I don't use it and I can sit here right now and do it before I get up if I know I have been sitting for a long period of time or, and I don't want to get up in the middle of the movie or what have you. And I can do those exercises before I get up and I'm able to make it to the bathroom. So, there's that one.
You've trained your pelvic floor. Now you know exactly. You've done it enough.
Yes.
Enough repetitions for a long enough time.
And that one is only 2.5 minutes twice a day. And it's small enough that you can put it in a little case and take it with you. And
what's the name of that?
It's called Leva. And I also have a QR code for Leva.
So we will put a QR code up on the screen for the ladies that are interested in this particular device.
It has 2 sides, so I'm not sure which one.
Yeah, absolutely. We can click on those, and if they want to get more information, of course, your physician or nurse practitioner will prescribe it for you.
And then they work with you to see if it's covered by your insurance. Not all insurances are covered. Everyone's is individual, but they set up the whole program to like once they receive the order, then they contact your insurance company and work with you on either a payment plan or if the insurance covers it. There's another one on Amazon that I've had great success with patients. It's called PeriFit. It's PERIFIT. It's probably about $100 to $130. Same concept. You're buying the probe and you're buying the app for your phone. There's just no company that's associated with it. So with that one, these people were brilliant because you can do it. And as you're looking at your phone, it looks like you're playing a game. So if you're not squeezing correctly, you're not going to jump or you're not going to run. And so, the concept is awesome because you can, sit there and no one would know you were using it. You do have to look at the devices because some of them are very big and that might be a little scary at first. So they do have ones that are in different sizes. You just have to look through the website for that one. So pelvic floor physical therapy and home devices do help and they buy you time if you're not ready to move on or can't make a commitment to some of the third line therapies.